So to start with, the first video I'm going to do is the pre-37 weeks. The idea of this is that it's really calming for you, so get comfortable. Use some moisturizer. I'm using some massage wax that I use for my treatments. It's got a lovely smell to it. You can make your own, which you can then use during birth. So use grapeseed oil as a base, and then any essential oils that are suitable for pregnancy, and enjoy it really. You can do this as much as you like. I'd highly recommend you do it as much as you like. So show this to your birthing partner, get them to have a go, and try it out. And also share this with any of your friends that are pregnant as well, because they all deserve it too. Okay, so start by getting your medium, whatever you're using, and just begin to massage the arms. And the idea behind this is just to get the blood circulating and awaken the senses. It's not often that our forearms get a nice massage, so this could feel really lovely. And just do it for as long as you like. This is your treatment, so you can tailor it to yourself. And then we want to work on the palms, and then just moving up each finger with a pinch at the end. Just like that. And then moving. Just remember to try and keep all of these moves really nice and flowing. It just adds to the calm environment. Perfect. So then we are going to start, and we'll begin with our solar plexus breathing, which is at the center underneath your knuckles. So you just hold there with your thumbs, and on the breath in you press down, and on the breath out just slowly rotate. We'll do 3 of those, so 2 more. And out. And breathing in and out. Lovely. So then what we're going to do is we'll start with the head. So we're just going to gently massage up the tip of the thumb all the way to the end. And you can see that I'm pushing in a little bit, rotating, moving up, rotating, moving up, rotating, and just continuing to do that at a nice gentle pace. And you can follow on whilst I'm doing this and do it with me. And then we're going to just press on the pituitary and the hypothalamus, 2 of the main endocrine glands. So just push in and rotate. And we move slowly onto the neckline, which is along here. So it's the base of the knuckle, the base of the tip of the thumb on the knuckle line. And just keep moving around it. Soft movements, and then down onto the thyroid, which is the base of the thumb, all the way down. You might be able to see that better on the second hand. And then we're going to move to the lungs. During pregnancy, the lungs and the diaphragm get really tight. So the lungs is in between each finger, so you're just rubbing down there. Rubbing down, and then you end up here at the shoulder. So I'm just going to do the shoulder. You just pinch in, and you can see we're just pinching in between the finger and just rocking back and forth. And then when you're you're happy with that, just move on to the diaphragm, which is this line here. So it's all the way under your knuckles. Just moving along. And pushing. It's not so much about the technique, it's just about the positioning. And it's whatever works for you, so at whatever pressure you like. And then we're moving on to the kidney adrenals, so just pinching into this V here. You can see, just pinch, press and release. Press in and release. Or you can just rotate as well, like that. And then we'll move on to the spine. So you take the hand as if you're giving it a good shake, and then you just move down the side of the thumb here, all the way down there. And this is all the spine. And then maybe just work this bit harder at the base of your spine and your sacrum. So that is that hand, and then you move on to the next. So, the head, up, rotate, up, rotate, up, rotate. Just nice and calm and slow. Pituitary gland, push and rotate, and slowly move into the neck. Like that. And then you can see better on this side the thyroid, which is this section here. So you're just moving, oh, you can feel a little knot there. And if you do feel a little knot, then just work it a little bit until you can start to feel it release. Thyroid, and then into the lungs. I always really enjoy the lungs being done. It always feels so lovely afterwards. And then into that shoulder there. And then into your diaphragm again. Another thing is you can push into the solar plexus and sweep out. Push in and sweep out. And then we're going to go to the adrenals. So just push in and release. Push in and release. You just want to be really calm on this area, because we want those adrenal glands to be able to work efficiently. Not in overdrive. And then again onto the spine. So working your way down. Now I've done that second hand quite fast because I'm just conscious that you're all watching on a video, but you go at your own pace. I'd recommend a slightly slower pace than I've done, and enjoy it. And then I end the treatment again and just some nice flowing moves